Hi, my name is Kimberly Harper, and I'm a registered nurse at the Collaborative for Maternal and Infant Health and a team member of the Fourth Trimester Project. The Collaborative for Maternal and Infant Health is dedicated to providing education to healthcare team members, mothers, and birthing people and community members. Today, we'll be talking about maternal warning signs. The body goes through a lot of changes during pregnancy and postpartum period. Many of these changes are normal, but some of them could be warning signs or red flags. This discussion will share those warning signs or red flags in ways that you can, as a family member, friend, or community partner, help. Some of the red flags could happen at different stages in pregnancy, while others can happen at any time. If you think that you or a pregnant person is experiencing one of these symptoms or something is just not right, it should be checked out. Some health problems during pregnancy and after childbirth can be life-threatening. Knowing when to call your doctor and when to go to the emergency room can save your life. If you experience any of these symptoms, you should call your doctor. If you soak through one or more pads in an hour, if you have clots bigger than an egg or you pass tissue, headache that won't go away or gets worse over time, severe pain that doesn't go away, such as in the chest or belly, fever of 100.4 or more, unable to drink for 8 hours or unable to eat for 24 hours, bad smells with vaginal discharge, if your blood pressure is equal to or higher than 140 to 159 top number or 90 to 109 bottom number. If you had a C-section, your incision is open, red, oozing, does not seem to be healing, or pain is not managed by medication. If you experience any of these symptoms, you should go to the emergency room or call 911. Suddenly very tired or weak, difficulty breathing and or chest pain, severe headaches and or changes with vision that don't get better with taking medication or with time. If your blood pressure is higher than 160, the top number, or 110, the bottom number, extremely worried all the time, you see or hear things that other people don't, thoughts of harming yourself or others, dizziness, disorientation, fainting, or seizures. If you experience any of these symptoms and you contact your healthcare provider and you do not receive a response, you should go to the emergency room or seek emergency care immediately. The first warning sign we will discuss is baby's movement. There's no specific number of movements that is considered normal. Knowing if there is a change in the baby's movement is what is important. For example, if you notice that the baby is normally very active, but now the activity is slower, it may be a concern. This should be reported to your healthcare team right away. It's normal to see some discharge during pregnancy. Having bleeding from the vagina that is more than spotting or is like a period, leaking of fluid from the vagina, or having a discharge that smells bad could be a warning sign. If you notice this warning sign, contact your healthcare provider and place a pad in your undergarment. This will allow them to know how much bleeding or discharge may be present. It's normal to have some bleeding after having a baby. The first 1 to 3 days after having a baby, you may notice that the bleeding is red, and this is called lochia rubra. Shortly after this time, you may notice this bleeding changes to a light pink, and this is called lochia rosa. After about 10 to 14 days, you may have a white discharge that is called lochia alba. These are all normal changes of the postpartum period. A warning sign in postpartum bleeding could be having heavy bleeding after delivery. Heavy bleeding would be soaking through one or more pads in an hour, passing clots bigger than an egg, or passing tissue or having vaginal discharge that smells bad. Fainting or passing out, dizziness and lightheadedness that's ongoing or comes and goes over many days, or experiencing a memory gap is a warning sign. Having family or friends around to notice this and act fast will help you receive the care that is needed. It's normal to be tired during pregnancy and in the postpartum period. The body's working hard to support and develop a baby. But if you notice that you're starting to feel suddenly very tired and weak, you don't have enough energy to go about your normal day routine, you don't feel rested or refreshed no matter how much sleep you get, or you feel so tired that you can't get up and take care of the baby, you may need to seek help. Some aches and pains are normal to experience during pregnancy and the postpartum period. Pain can influence a lot, from sleep to mood to exercise. Managing normal aches and pains can help with overall health during this time. In this section, I'm going to share some pain that might be warning signs. If you have severe belly pain that doesn't go away, it's pain that has a sharp, stabbing, or cramp-like belly pain that starts suddenly and is severe or gets worse over time, or if there's severe chest or shoulder pain or back pain, is a sign that you need to contact your healthcare provider. Headaches can be present during this time for many reasons: lack of sleep, stress, or needing to eat. Headaches that start all of a sudden with really bad pain, it's almost like a clap of thunder. It feels like the worst headache ever, throbs and is on one side of the head and continues after taking medication or drinking water, are all signs that you should contact your healthcare provider. Unusual visual changes such as seeing flashes of light or bright spots, blurred vision, if you can't focus or start seeing double, or if you have blind spots or if you can't see for a short period of time, you need to contact your healthcare provider. Chest pain, such as a feeling of tightness of pressure in your center of your chest, pain that travels to your back and neck, a change in your heartbeat, such as a fast heartbeat or pounding in your chest, an irregular heart rate, or a skipped heartbeat, feeling dizzy, faint, or disoriented, or having trouble catching your breath are all signs that could be a problem. Swelling, redness, or pain in the leg are usually signs that are noticed in the postpartum period, but could also be seen during pregnancy. If you notice swelling, pain, or tenderness in the leg, it's usually in the calf or in one leg. It may or may not hurt when you touch it. The pain may be present when you stand or walk. There may be a painful area that is also swollen and warm to touch or red. These are all things that you should contact your healthcare provider. Severe nausea and throwing up. This is beyond the normal queasiness feeling that you usually have in early pregnancy. You'd feel sick to your stomach, you're unable to drink for more than 8 hours or eat for more than 24 hours if you throw up and can't keep water or fluids down. Having a fever or a temperature that's greater than 100.4 could be a sign of infection, and you'd want to contact your healthcare provider. If you notice extreme swelling of your hands and face, if it's difficult to bend your fingers or you're unable to wear your rings, if you have swelling in your face and it makes it hard to open your eyes all the way, or they feel puffy and they look puffy, or if your lips and mouth feel swollen and you have loss of feeling, you may need to contact your healthcare provider. Sometimes people may experience high blood pressure in pregnancy. Knowing your numbers and what to do can help you receive the care that you need when you need it. This is an educational tool that you can use to know your numbers. If your blood pressure is in the green zone or the good zone, your blood pressure is less than 140/90. Your blood pressure is in the yellow zone or the take action zone if your blood pressure ranges from 141 to 159/91 to 109. Your blood pressure is in the red zone or the emergency zone, where you should get help immediately if your blood pressure is greater than 160/110. With all the hormonal changes and physical changes that happen in the body during pregnancy and the postpartum period, a lot of people experience changes in their mental well-being. Having a supportive village and mental health providers can help to ease this time of transition. But if you start to feel very sad, hopeless, or not good enough, you don't feel that you have control over your life, you feel extremely worried all the time, or if you have scary thoughts that come when you don't want them or it's hard to get rid of them, it's important to reach out to a healthcare professional. The Trimester Project has worked to develop postpartum care materials for providers and new parents. These tools can help you to prepare for the postpartum journey. NewMomHealth.com is a website dedicated to providing support to help you navigate the postpartum period. In addition to the website, there are one-page health information sheets for birthing parents and new babies, booklets that talk about how to take care of yourself after having a baby, and postpartum plans. The postpartum planning tool is a document for new parents. It's a guide to help you think through ideas for supporting during the days, weeks, and months after delivery. Sections include contact information, communication, visitors, nutrition meals, ways to support the new mother, and points to consider for mental health. The postpartum care plan is a document that can be used with your healthcare provider to help expecting and new families understand and manage their healthcare needs. The healthcare professional can fill this out and update as needed. Sections include My Care Team, calling for help, appointments, medications, support for me, questions, building my village, and sharing my story. The fourth trimester team also has video reels to help support when to call for help and when to go to the emergency room. They're postpartum and maternal health warning sign videos that can be found on newmomhealth.com. We hope this session on maternal warning signs has provided helpful information for you as you support yourself and others during the pregnancy and postpartum journey. To stay connected, you can subscribe to mombaby.org/contact us or follow us at UNCCMIH. This presentation was supported by the Center for Disease Control and Prevention of the United States Department of Health and Human Services as part of an award totaling $450,000 with 0% financed with non-governmental sources. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by the CDC, HHS, or the U.S. government.